thanks for your invitation, and thanks to let me share our experience with medical abortion and telemedicine. So just I want to remind the legal and medical condition of medical abortion in France before the COVID pandemic. And I will tell you after what has changed after and during the pandemic. So medical abortion was authorized at home up to 7 weeks LMP, 6 weeks pregnancy, in private offices, primary care centers, family planning center, and of course also at the hospital. Medical abortion can be performed in France by doctors, GPs, and OBGYN, and midwives. Since 2015. I have to tell you that we have a lot of general practitioners performing medical abortion because we have trained them for years now, and it works quite well with general practitioners also. Between 7 and 9, before the COVID pandemic, medical abortion was authorized only in hospital setting with at least 3 hours stay following misoprostol intake. So what happened before the pandemic is that mifepristone and misoprostol cannot be bought in local pharmacies by women, but only delivered by the practitioners. The practitioner, the provider, bought them in the pharmacy, but not the women. Also, one information is in France, medical and surgical abortion is fully reimbursed by the health system. And this is true also for undocumented migrant women, but for migrant women, it's only possible free of charge in the hospital, not in private practice. And last and very important thing is that telemedicine was not allowed before the pandemic for performing medical abortion. But also I have to say that in a way, telemedicine was underdeveloped in France in general. It was very little used and only authorized for the follow-up of patients with chronic disease like diabetes, for example. And also you couldn't see by consultation a patient that you didn't knew before. So we didn't use telemedicine in gynecology in general. It was used by some general practitioners and in certain conditions. So it was really underdeveloped anyway. As you will see, we are doing a lot of medical abortion in our country. In 2020, 70% of all abortion were medical abortion. And among these, 25% were performed outside of hospital setting, as I told you, by midwives, general practitioner, and OBGYN. So it's almost all the abortion are medical abortion in our country. Access of abortion in our country is not bad, and we even could say that it's quite good. But what happened is that there are some geographical disparities and heterogeneity of care offer regarding the choice of abortion method. For example, you can find some region or you will not have medical abortion at home, but only at the hospital. And some region, for example, Paris and the big suburb, where you will find easily medical abortion outside of the hospital. So there is a real disparity between the regions in our country. So what happened during the COVID pandemic is within the framework of the health emergency law, derogatory measures were adopted for medical abortion outside of the hospital setting. And this starts in April 2020 at the very first lockdown and is extended until July 2022. Well, the pandemic is not finished, so it's normal that it has been extended. So what the derogatory measures are is that there is an extent to 9 weeks. So it was 7 weeks, now we are allowed to do up to 9 weeks LMP outside of the hospital setting. And also something which is quite revolutionary is that all the consultation necessary for medical abortion can be carried out in the form of teleconsultation if the woman wishes and if the practitioner considers it possible. It means with these measures that medicines, MyFay and MyZo, can be delivered directly to women in local pharmacies. It means also that the provider, we are doing a prescription. The prescription is sent by mail to the pharmacist chosen by the woman, and the woman go and take the drugs in the pharmacies. It means also that the women do not have anymore to take the drugs in front of the provider, and of course not in front of the pharmacist. So that's also something which has changed. And of course, because abortion is free of charge in our country, there is no advance fee in the pharmacy. The pharmacist is reimbursed of the price of the drug directly by the health system. If you see the number of abortions performed by telemedicine, you can see that it's a very small number, 728 in 2020. As you can see on this slide, it's important during the very first lockdown in March, April and May. This lockdown was very strict, and also the second lockdown in November. So it's a very small amount of abortion performed by telemedicine. So why such a small amount? Probably because of the reluctance of the providers. We were afraid of this procedure, but also a lack of knowledge about this procedure can be done. And also something is that abortion services remain open even during the lockdown, even during the strict lockdown, for example, the first one and the second one. And the abortion service remained open and responded to the need. So women went to the hospital for the abortion too. It was not closed. In our experience, because I did some of this medical abortion by telemedicine, women were quite satisfied. And the problem that we have is that pharmacists were not well informed of the procedure and sometimes did not want to deliver the medics. So a lot of time I had the women call me, for example, and I have to call the pharmacist, explain them that it's legal and explain them that they can give the medics to the women. Also something which happened in 2021, Women and Way, which is an online telemedicine abortion service operating worldwide and mainly for countries where abortion is illegal or not easily accessible. So Women and Way decided to do a survey in France to understand the demand of telemedicine abortion in a country where abortion is legal and quite accessible. And they analyzed the request received from France during 2022. Of course, the survey was decided before COVID, and there was a confusion with the COVID. And of course, as you can see on this slide, there was a significant increase of demands during the first and the second lockdown in 2020. What emerged from the analysis was not only linked to COVID reason, because women say that they need and they want to have these online services because of secrecy, because they want secrecy, they want privacy, and it's more comfortable. And these are the most frequent reasons for women asking for telemedicine abortion. And they were speaking a lot also of violence and how they were afraid of their partner, and how it's more privacy like that. What were the consequences now of the COVID pandemic? The consequences was quite good for us because health authorities is now determined to perpetuate the measure taken during this emergency period. we design and we participate in designing a new guideline, which was published in March 2021. And this guideline recommends the extension to 9 weeks LMP outside of the hospital setting and confirms that new regimens are safe. A new regimen is 200 MyFe and 400 or 800 MyZo. But also the possibility of teleconsultation could be safe, and medicine can be dispensed directly to the women at local pharmacies. In practice now, what happened? We are still on COVID pandemic, of course, but the situation is not like the first and the second lockdown. So anyway, in practice, there are few medical abortions performed completely by telemedicine, but some are partially performed by telemedicine. For example, for the first visit, when we need an ultrasound, the ultrasound is prescribed. So sometimes it's one telemedicine consultation and one in presence. And so ultrasound is not mandatory, but it's very most often done and asked. Also, telemedicine is very much used for the follow-up visit. And also what we are doing a lot is counseling and contraception by telemedicine. Lesson we have learned from this COVID period is that there is a need for this kind of services because this kind of services can reduce geographical disparities. And also it can allow a more rapid and earlier interruption of unwanted pregnancy, reducing the delay of appointments, can facilitate access by avoiding travel and transportation. What I really discovered, even in France, it's a small country. For some women, especially in rural area, it's not easy to go from one point to the city, for example, where there is a hospital, because when they don't have a car, it's not really easy to go. And also it can allow a better organization concerning work and family commitment. And for some women, it's more confidential. The problem is now to convince provider that it is possible, that it is safe, and that women can and want more autonomy, because we know, and we know for a long time now, that self-management of medical abortion is non-invasive, cost-effective, acceptable, and improves autonomy. Thank you.